Reducing Hospital Readmissions at ZSFG, a comprehensive strategic and marketing plan. My name is Danna Falla, and I am a graduate student at the University of Texas in Arlington. Zuckerberg San Francisco General Hospital and Trauma Center is the centerpiece of the San Francisco Health Network in the San Francisco Department of Public Health. ZSFG is the only Level 1 trauma center for San Francisco County and adjacent San Mateo County. Through its partnership with UCSF, ZSFG is also a teaching hospital. ZSFG is a community nonprofit hospital that consistently meets its aim to serve all San Franciscans, with 1 out of 8 San Francisco residents seen at ZSFG each year. As a public safety net hospital, public payer sources accounted for 90% of inpatient days in fiscal year 2019-2020. ZSFG's mission is to provide quality healthcare and trauma services with compassionate and respect. Its vision is to be the best hospital by exceeding patient expectations and advancing community wellness in patient-centered healing environment. Three primary values at ZSFG are joy in our work, thirst in learning, and compassionate care. The patient care delivery process and model of care at ZSFG are best encapsulated in the organization's True North framework. The model of care is resolutely patient centered, with the patient and the broader community of San Francisco at the apex of the True North pyramid. The organization's mission and vision are aimed at serving patients and the community. The values reflect the culture that enables the organization to meet its mission and aspire towards its vision for patients and the community. The six True North goals in the categories of equity, safety, quality, care experience, workforce care and development, and financial stewardship reflect the organization's commitments to serving patients, the community, employees, and the organization. Together, the components of the True North framework describes the ZSFG way, or how the members of the organization lead, mentor, engage, and improve in service of the mission and vision for its patients and community. The strategic plan addresses the problem of avoidable 30-day readmissions in HRRP eligible Medicare inpatients. The plan objectives are to reduce avoidable readmissions and associated costs and patient harms in this patient population and improve the quality of care transition in Medicare patients. The plan is a 3-year focused initiative to improve care transitions for HRRP eligible Medicare patients by mobilizing a focused team of RNs within the existing team to improve transitional care among the patients. RNs will assess and meet every eligible patient to assess transitional care needs and then liaison and coordinate with providers, facilities, community agencies, and patients to optimize the care transition. The goals of the strategic plan are to reduce HRRP related readmissions, and their associated costs and patient harms, to improve care transitions and their associated patient care experiences, and to increase revenues in revenue generated cost centers related to the six HRRP conditions. The marketing plan aims to promoting the strategic plan for a readmission reduction to both internal and external target markets. Nursing leadership and RNs on the transitions team, along with representatives from human resources management and the media and communication departments, will be responsible for carrying out the plan. The marketing plan has a first year budget of $62,500. The immediate goal is to increase Medicare's patient awareness of the program to at least 50% after 1 year. Progress on the program will be assessed every 6 months. The primary internal target markets for the program are the RNs involved in the readmissions reduction initiative and the RNs and other hospital staff involved in care of Medicare inpatients, as well as the hospital's Medicare patients and families. The primary external target markets are Medicare patients in the community, community partners, care partners, local providers, and local media. Promotional activities during the initial phase of the plan will focus on recruiting RNs for the transitions team. Both internal and external recruitment flyers and ads will be used. As the program gets underway, promotional activities will include internal promotional and informational literature for staff and partners, as well as patient flyers explaining the program and its benefits. Promotion to the external market will include informational flyers for patients, community, partners, and providers, as well as press releases to local media. The service line for this plan is to reduce HRRP related readmissions as a result of improvements to transition of care. It is assumed that the plan will result in net annual reductions in target readmissions to meet target declining annual readmissions rates from the baseline 17% to 16.5 in year 1, 15% in year 2, and 13% in year 3. Projections include an assumption of a 6% growth in patient volume in years 2 and 3. Cost savings from the readmission reduction program have been calculated at $15,500 per readmission. The projected the project team costs are based on 2 hours of RN time at $75 per hour, which with each of the HRRP eligible patients. Net cost savings will incur when savings from readmissions reduction exceeds project team cost for the year. There is a projected loss of $1,336,500 in year 1. For years 2 and 3, cost savings will exceed project team cost as a result of achieving significant reductions in readmissions. Moreover, it is anticipated that direct revenues will rise as a result of increased revenues in revenue generating surgery cost centers that will occur as readmissions fall in these cost centers. Overall, a net revenue increase of $2,597,550 for year 2 and a significant net revenue increase of $13,495,800 is projected for year 3. This plan is a focused initiative to address the problem of unplanned readmissions in HRRP eligible Medicare inpatients with implementation of a focused RN led transitional care team to improve transitions of care in these patients and thus reducing the risk of readmission. This plan thus addresses an important problem and adversely impacts patient experience, patient outcomes, and hospital costs. The plan, as presented here, draws on existing strengths and resources. Most importantly, the plan and its goals and methods are consistent with ZSFG's mission, vision, and values in the True North framework. The service line and volume projections have shown that achieving the planned goals of reduced readmissions will improve patient experiences and patient outcomes and led to net cost savings overall as well as increasing net revenue for the organization. It is therefore recommended that the plan be adopted.